with a simple mind like mine, I would think that if you could replace dopamine and have your brain cells replenish dopamine, that you could cure Parkinson's, but it's not that simple, is it?
It isn't. So it's not just a disorder of decreased dopamine. The dopamine receptors are also not, they're not metabolizing dopamine correctly, and we don't know why that occurs. So what we've started to do in research is find common abnormalities in people that have Parkinson's and try to fix those abnormalities. Recently, there's been some studies on a protein called alpha-synuclein, and alpha-synuclein is found misfolded in people that have Parkinson's. So what we were doing in some studies a few years ago, wiping out the alpha-synuclein, washing it out of the body, and trying to reverse the disease.
So when we have misfolding proteins, like Dr. Shafer talked about, is that we know that the clumping part of it, ultimately when you misfold, you have this adhesiveness to these alpha-synuclein, which makes them bigger and bigger clumps. And so when they go into the cell, which is a normal process, we all have alpha-synuclein, that protein. But when it goes into the neuron, it has this clumping ability, and the glue makes it bigger and bigger and bigger inside the cell. So what happens is that that neuron can no longer function like it should. That neuron should be making dopamine. That's the whole purpose of that cell. And so what happens is that our lovely, wonderful immune system says, okay, there's a cell that's dysfunctional. And so we take that neuron out. And so we keep on doing that over and over and over to a place where you have less and less neurons that make dopamine.
Oh, so the immune system plays a role
Yes.
in Parkinson's by knocking out abnormal cells.
Correct.
But then it also knocks out some of the cells that are still producing dopamine.
Exactly. There's an opportunity for us that I think is going to be really amazing as time goes by. They have found that there is something called Tyrosine Kinase. It's an enzyme that ultimately creates the clumping. And there's medications out there that have been used that are repurposed from chemotherapy drugs that can actually stop the clumping from happening. So imagine if you have a declumper.
A declumper, I like that. I'd like to become a declumper.
And so if that declumper works, it stops the pathology from happening and that neuron stays happy.
Gotcha.
And if we have that, then we have an opportunity for these
Very
patients
exciting.
to feel better. I agree.
Is there an overlap there because of the misfolded protein? Do patients with Parkinson's have a higher risk of neurodegenerative cognitive loss, such as Alzheimer's?
It's similar to Alzheimer's, but also different. I like to say it's a Venn diagram where you have very similar symptoms amongst the different disorders. So yes, they have a higher incidence of things like dementia, but it is a bit different than Alzheimer's. The other things that we're looking at are the genetic code. 7% of the Parkinson's population, it has a known gene that causes Parkinson's. The rest we don't know about. So one of these studies that has been ongoing through the Michael J. Fox Foundation is going after one of these genes. We now know how to splice the genetic code, splice things in, splice things out. And so what we have been doing in some of these studies is actually splicing out known genes and perhaps reversing the disease. So those are ongoing studies that we're doing right now.
Pretty exciting for the folks that have not had much hope. Exciting possibilities in the realm of research. I've also read that stem cells can cure anything. Stem cells are the progenitor cells, as they're called, the cells that evolve into specialized cells. Now, any hope with stem cell research that we can train them to evolve into the cells that secrete dopamine and thereby cure the disease? Doesn't sound like it, given what Saulena said about the receptors also being an issue. But what do you think about stem cells?
The difference between getting stem cells for Parkinson's disease is that you ultimately have to do the injection into the brain, because what happens with stem cells is the environment's important. And so what happens with stem cells is they're something called pluripotent. They don't know what they're going to become. And so the first step is actually making them neurons that are not programmed yet. And once you inject them into their space, they look around and they say, okay, this is what I need to become. And so you have to have targeted availabilities to actually have the injection into the brain to allow it to actually know what to become. And then the idea is that once it becomes a dopamine-producing neuron, it creates an opportunity for us to have more neurons that are not diseased. in the disease state of
So
Parkinson's.
the cells also have to survive the injection
Absolutely.
and proliferate, because we have gazillions of cells in the brain and millions and billions of cells that secrete dopamine. So it's not just, hey, we'll take a thimbleful of stem cells, stick it in the brain, and we're
Yes,
done, right?
exactly.